Hello, today I'm here to talk to you about the surgery I had recently called lumbar laminectomy surgery. Bit of a background. It's now November. I had some symptoms with sciatic nerve pain down my left side starting in January of this year. The symptom was I would sit down for a long period of time and then stand up, and then there would be the pinching in my nerve. This came from pinching of the spinal cord. But to alleviate this, I would have to stand up, sit back down to relieve the pain, stand back up and down for about 10 minutes after sitting for a long period of time to eventually relieve the pain. And I'm also enjoy cycling. If I was on the bicycle for more than about 45 minutes, the pain would come down my entire leg, and it would almost get to the point of just being completely numb. So I started physical therapy to try to alleviate this pain, and it was not successful. Finally, I went to see a doctor, and the first doctor recommended a back fusion. It's some screws in your back to fuse the vertebrae together. And naturally, I went to the next doctor to see what else might be available. And this was based on an MRI done, a CT scan, and also probably some physical touching to see what the situation was in the back. Um, so I elected to do this lumbar laminectomy surgery, and it's less invasive than fusion, probably less pain afterwards. It's a shorter procedure and less recovery time, of course, as well. So I had outpatient surgery on October 11th for this lumbar laminectomy, and it was all seemed fine. The pain was from my sciatic nerve was virtually gone right away, so that was 95% gone. I get a small reoccurrence every now and then, but really it's all but gone. So, and the pain I had after the surgery was minimal. I was given all these pills. I just took minimal amount of medicine afterwards. I had something for nausea, something for pain, and something for muscle spasms. I really didn't have too much of any of that, fortunately. So I minimized taking any of those pain pills. Uh, so the recovery involves a long period of time of doing no exercise, virtually just taking it easy, and that's really not my forte, so to speak. I like to be out, active, the outdoors. So I'm just following the doctor's orders as best I can to try to get back to normal. I'm touching on a little bit of swelling I had after the surgery. It persisted, it got worse. The doctor decided after the third visit to go back in to my back and explore what might have been the problem. Apparently, it was thought to be what was called cerebral spinal fluid leakage. When the doctor went in, she said she found no leakage, or the leakage had apparently fixed itself. And she put a suture in there or something to ensure no leakage, and then closed it back up. All done with glue. It's about a 5-inch incision. That's 12 centimeters for you metric folks. And that was closed back up with glue. Now the swelling has gone down after about 3 or 4 days after the surgery. All is fine, but the second surgery involved staying at the hospital for a day to be monitored, and now all is well. It seems to be healing. Light activity is okay, walking is okay, I can negotiate stairs, I can fix meals, I can function normally, taking a shower, all that seems to be fine. I saw horror stories with the back fusion. I'm sure some of you that know people that have had back fusion, they're on a walker to try to get back to normal. It's very invasive. So my recommendation would be, I'm not a doctor, would be to explore every option and see what can be done minimally. And my doctor followed this theory of doing as little as possible to fix the problem. No lifting, no cardio. I can walk short distances, and no lifting more than 15 pounds. Hope to be back to normal soon, and I hope you found this video helpful. I wanted to keep it at 5 minutes, and that's about where we are right now. So out here enjoying this nice fall day. So y'all take care. Wish you the best in your recovery. See y'all later.